When my dog Ruby had her first seizure, I remember thinking, okay, let's treat this, fix it, and hopefully move on. But epilepsy doesn't work like that. And if you're here because your dog was just prescribed an anti-epileptic drug, or maybe you're still trying to figure out if it's time to start one, you're probably wondering, is this forever? Let's talk about it. Welcome back to Learn with Ruby. I'm Mandy and my dog Ruby has epilepsy. This channel is all about sharing what I've learned over the last 8 years of caring for Ruby after her epilepsy diagnosis to help you feel confident and supported while caring for your dog with epilepsy. Anti-epileptic drug therapy, commonly called AED therapy, is often the foundation of managing epilepsy in dogs. These medications reduce seizure frequency, shorter duration, and help prevent dangerous clusters, which can lead to status epilepticus, which is when they don't come out of the seizure and is life-threatening. They save lives, but they also come with a commitment. Here's what many pet parents don't realize right away. Once seizure medications are started, they're usually a long-term, if not lifelong, commitment. That's not because your vet wants to keep your dogs on meds, it's because your dog's brain needs consistent medication to keep seizures under control, and stopping suddenly can be dangerous. Anti-seizure drugs work by calming overactive electrical activity in the brain. They either increase inhibitory signals or decrease excitatory ones. Over time, the brain adjusts to the presence of the medication. So if it's stopped or even delayed, that balance is disrupted, leading to rebound seizures that can be more severe than before. A common question is, if my dog stays seizure-free, can we eventually stop the meds? It's a fair question, and in some rare cases, dogs who have been seizure-free for a long time or long periods might be slowly tapered off. But that decision is a complex one, and it always involves weighing risks versus reward, especially if the seizures were ever severe, clustered, or medication resistance to begin with. For Ruby, more than likely due to her seizure patterns, her medications will be forever. I want to pause here for something really important. Just because seizure medications are often lifelong does not mean you should delay starting it if your vet recommends it. Waiting too long to start anti-seizure medication can actually make things worse. Because the more seizures a dog has, the more likely their brain becomes sensitized, meaning it starts to expect and repeat seizure patterns more easily. It's called the kindling effect, and it can make future seizures harder to control. It's like a tiny spark in dry grass. One seizure, two, and suddenly it's a wildfire. The longer we wait, the harder it is to get those fires under control. If your vet has recommended starting medication, it's for a good reason. Maybe your dog has had multiple seizures, or maybe their seizures are intense, long, or clustered. Those aren't something to wait and watch. That's when treatment can mean the difference between life and tragedy sometimes. Starting meds isn't a failure. It's not giving up. It's a powerful step toward giving your dog a safer, more stable life. And you'll never regret acting early to protect your dog's brain. I know it can feel overwhelming, the schedule, the cost, the worry, but I also know this: seizure medication gave Ruby her life back, and it gave me peace. Because every day the meds do their job. It's a day Ruby can just be Ruby. And if you're just starting this journey, you're not alone. There's a whole community of pet owners with dogs with epilepsy who get it. And if you're feeling nervous about committing to lifelong medication, that's normal too. But know this, you're doing what's best for your dog. You're giving them safety. If you want to learn more about the different seizure medication options, please check out the first 2 research articles in the medication research section of my website, learnwithruby.com. If you haven't started tracking your dog's seizures yet and need an easy way, check out my Seizure Tracker. Link is in the description. And as always, thanks for learning with me as I learn with Ruby.